Reentry Corporation of America was created to fill the void that exists between the consumer and the public health hospital. As you well know, many consumers experience services within our nation's emergency rooms. RCA fills a void that exists around the nation with every public hospital system of offering accessible mental health and substance abuse services that help to reduce recidivism.
One thing that this program has done that's different than a lot of others, and probably the reason behind the small recidivism rate, is that they really teach people to reinvent their lives.
As a result of cuts in government spending, many of our public mental health facilities are overwhelmed with individuals due to lack of insurance.
State budgets are now being reduced as a result of deficits all across the country. And when institutionalization of care is cut, that increases the need for more community-based services in the community.
I was not able to receive any of my unemployment. I was not able to receive any kind of assistance. I was forced into filing for my disability. I worked all my life and paid into the system. And it's like the system failed me.
When the system is overwhelmed, individuals do not receive the quality care that will promote their healing and well-being, thus creating a revolving door to the mental health care system.
I lost a son and my grandparents pretty much at the same time, and I told them that I suffer from depression and that I need one-on-one counseling, and they did not give me no options.
If you can't trust the staff that's working with you on your mental issues at that time when you're depressed or in a manic episode, then how are you going to trust yourself?
RCA offers a program that empowers the client to move from a negative state of mind to a can-do attitude of wellness.
We offer a one-stop shop concept. Not only can we address the addictive disorder needs, the behavioral health needs, but those individuals who are getting out of prison, many of them possess the same problem. We link our patients to the appropriate resources that they may need for educational purposes, for job placement purposes. We want to keep them in an environment where they're safe and an environment that's most conducive to the treatment that we're providing.
RCA possesses the right staff with the know-how to provide professional, courteous, and competent services that enhance a client's participation and program completion.
We have licensed certified social workers. We have psychiatric nurse professionals. We also have mental health technicians who are also serving the capacity as drivers.
We empower the client to access their own situation and take control as we offer resources and support.
The thing that makes our program different from other mental health facilities is our case management and a caring staff.
They don't see this just as a job, but they see this as a service to their fellow man.
I was quick to pick up the phone. I said, look, somebody better talk to me, or I'll run up there to Mr. Henry. Mr. Henry, I'm feeling something finna happen. Mr. Henry, he'll sit right there and talk to me. If it wasn't him, it was Teresa or Michelle, one of the pastors, one of the counselors. Anybody I turned to, nobody.
Many of our patients we found not only have a behavioral health diagnosis, but they also have addictive disorder disease. And so we have a facility designed to treat our patients who suffer from addictive disorders.
I smoked for 14 years though. Okay. When I walked in there, I probably weighed 168 pounds. Bam, now I went back up. Can't tell me I ain't working the program.
What makes this program different from other traditional mental health facilities is that our staff believes in the client.
It is all about having quality people and quality case management working with these individuals.
I saw a young lady today that just really touched my heart. She talked about the program, but more importantly, she talked about the commitment. She talked about the clinical needs that were met, but when she said that he didn't give up on her, I knew that that's something that was about him and why his program is so successful. And we are so excited about being part of it.
The federal government should model after RCA because the program works.
We have treated since 2006 approximately 350 patients, of which only 13 patients have gone back into the hospital.
RCA closes the gap between the consumer and the holistic services that they need to progress in treatment. The void is filled with quality mental health care and access to aggressive and proactive case management.